generations, and are also accountable to the people that they serve. Specifically when we are talking about the differences between equity and equality. I think equality sounds like fair on the surface, everyone gets the same thing. But that really only works if we're all starting from the same place, and that's not the reality. Some people are carrying more burdens or facing more barriers than others. And so equity is different. It means that we are recognizing those differences and then designing solutions that actually meets people where they are. Means that people are actually getting what they need and not just what everyone else gets. So an example of that would be relaying this to like maternal health. So like an equitable or an equality type model would mean every pregnant woman gets the same or gets offered the same, amount of prenatal care visits. But using an equity-based approach, we really look at the whole picture. So like, does she have stable housing? Is she actually able to make it to appointments? Are there language barriers? Are there other clinical risks? So an equitable system would mean supporting someone holistically. And that's what we're supposed to do as community advocates, see the full person and build that trust and push for systems to do the same.
Great, thank you. Tiffany.
There's not much that I can add to that definition that Dr. Evans provided. So that is right on par with what I've always, taught and trained on when it comes to the difference between equity and equality. I will add to it that designing equitable systems there's a huge challenge because the systems were designed to be inequitable from the start, right? So it's a whole breakdown. I mean, how do we go in and really break down these systems and rebuild them? But yes, I there's nothing more that I can add to what Dr. Evans, her definition, and so that it's shared. It's a shared understanding there. So thank you, Dr. Evans.
And Calvin, would you like to add on to that, expound on that in any way?
Sure. Just I'll also agree that was very well said. I guess just piggybacking on that, when I think of equity versus equality, like she said, I really think of, things can be equal, but that doesn't mean it's the same experience. And one of my favorite examples that I learned from, was three people watching a baseball game, and they all have three different heights. And so if you give them all the same stool, they may not all be able to see. You have to give them the one that's fit for them. But even to take it a step further, as you said, getting that full perspective, you're just looking from the back, you may get them each the just right stool for them and think they're okay. But if you get the full 360 view, you may see one of them still squinting and he might need glasses. So it's just, really taking those steps to make sure that people get a chance to share in the experience.
So since we're here talking about systems, and as Tiffany pointed out, how challenging it is, especially with designing equitable systems, as Dr. Evans pointed out, how did we get here? Can you walk us through a little bit about some of the racism and biases that are embedded within our healthcare system that have created some of these barriers and systemic challenges that you all have mentioned, as to what needs to be addressed to even lead us to equity? How did we get to this place? Anybody, please jump in.
I guess I'll see. A slippery slope, I'd say. Looking at the social determinants of health, which to my understanding weren't even identified and spoken on until the past couple decades. So it started.
Okay. Oh, is it me or
symptoms, not the actual diseases that are causing us? Sorry, did I go out for a second?
Just a little bit, but I think you're back.
Oh, let me. Can you still hear me? Oh, okay.
Yes.
Sorry about that.
Yes.
I'm not sure
That's
what
okay.
you heard. But sorry, I was just saying that if we are, these things snowball. So a lot of times we're seeing the issue on the surface, what it looks like, but it's really something way down upstream. Like, for example, you may see someone this kid may not be doing well in school. You may think, oh, the school is the problem, but it may be, okay, well, maybe he's not arriving to school on time. So then you think, oh, maybe it's parent. But then maybe the parent has a weight on them. And maybe there's something else pressuring that. So you really have to kind of trace back and find, first up the streams of these issues and then the major pools where it's like, okay, transportation may be the major issue, or, health access may be the major issue. And it's complicated. It takes good minds, it takes ears on the street, it takes people talking to people, it takes research, it takes everything that goes into it to kind of figure these things out.
Mhm.
I wanted to add to that, when we start talking about the social determinants of health, whether it's transportation, whether we're looking at healthcare, I can go through almost any part of certain parts of my community, which is Prince George's County, Maryland, and you will see food deserts, and you will see food deserts in a community that has been labeled as one of the wealthiest communities for Black people in the country. Yet and for all, you see significant food deserts, but then you also see dialysis centers in all of those same areas, right? So that's by design. It's very strategic and, excuse me, and very deliberate. We live on a planet that has everything that we need in terms of being able to provide the abundance, but it's very relegated and very parsed out according to who people in power believe is deserving of that abundance and having access of it. So they make it seem like there's a scarcity. And so a scarcity model gets framed for us to believe in, but we have the abundance. It's just a matter of those that are in power that are very strategic with withholding that. So again, when we get to communities having access to fresh food and transportation to get to and from work or employment opportunities, it's very much so by design. Even in places where we start to say, well, this area is considered wealthy, but then when you look at our neighboring communities and all things considered equal, in Prince George's County, we have our neighboring communities. We don't possess the same level of wealth, although we have higher levels of education and all in access to certain opportunities, but yet and for all, our very community that we live in has grocery stores or lack of grocery stores, fast food restaurants on every single corner, multiple fast food restaurants. So where do people go to get their food? When you have limited access within a certain mile radius of where you live, but then there are other communities that are being built up right down the street that are all focused on how do you live, work, play, worship, all within these walkable, livable communities. But we're not seeing them come into certain communities where predominantly Black people and other people of color reside, regardless of wealth and education opportunities.
And this sounds a lot like Dr. Evans, you talked about, approaching it from a holistic standpoint and seeing the whole of a person and their needs in terms of social determinants of health.
Yeah, I'm really glad that this came up because I mean, nearly 80% of the health of a person happens outside of, clinical settings. So like everyone said, it's your housing, it's transportation, and many of these factors disproportionately impact Black communities. So the disparities, aren't necessarily random, and they're a direct result of intentional policy decisions and generations of disinvestment. So it's something that really should be the forefront of conversation, especially when we're talking about health disparities. It's not just specific risk factors, and race is not a risk factor. We're actually talking about the systems and how they've been designed to consistently leave us behind.
Can you talk a little bit more about how race is not a risk factor and, how health disparities kinds of shows up in in Black communities?
Yeah, so just because you're Black doesn't mean that that's not a risk factor for cancer. You're not born, I'm Black, I'm gonna have cancer, or I'm gonna have high blood pressure. That is the direct result of the systems that have been created to limit our access to resources. And so here I'll get into like a little bit about health disparities, and what's the most unfortunate thing is that they're preventable. And it can be addressed through just increased access to care. It's directly and deeply connected to different social, economic, environmental disadvantages. And so chronic disease, for example, in Black communities, we see higher rates of hypertension, diabetes, heart disease, and they're not specifically just about your race or individual choices. They come from structural issues like limited access to preventative care or environmental stressors like the food deserts that Tiffany was just speaking about. And then just like a history of maltreatment in medical settings. A book I'm going to plug is The Medical Apartheid. It's a really tough read, actually. It's very detailed about from slavery through recent times, how Black people have been, guinea pigs to our medical system, which has, in a way advanced healthcare overall, but it's been very detrimental to us. We have not benefited at all. And consent becomes an issue here as well. So those are some pressing issues. And then as a result of that, there's like chronic stress that we all kind of face, and racism can create chronic stress both in our everyday life, and we can experience it in healthcare settings as well. One of the things or the terms that we really focus on in research is the term weathering, which I'm sure you all are familiar with. The idea that like the cumulative total of stress across your lifetime accelerates your aging. So you may be 25, but you're really like 60 based on, the way that you've internalized different stressors. And then you can see the same thing in like maternal health. So you have chronic health conditions and then you get pregnant. That's like an extra toll on your body. And Black women are, 4 times more likely than a white woman to experience a pregnancy-related death. And that's irrespective of income or education, which are typically seen to be protective factors towards just certain things. So it really highlights that this isn't about your race. It's really our systems that have put us in this situation. It's not biological differences. So it's the implicit bias and the racism that we receive in clinical settings. It's the lack of responsiveness that we experience when we're trying to advocate for ourselves, discussing pain and symptoms. It's just different barriers to care. And then just, again, policy and socioeconomic factors. And so it's really important to know that these aren't just like data points, but it's a direct reflection of our broken system that was never built with us in mind.
And I hear a lot about trauma and generational trauma and the impact. I wonder, I know Tiffany, I know you have some training in trauma and trauma-informed care. Can you talk to us about how trauma, the role that trauma plays in health disparities and in our health and wellness?
Absolutely. I know that Dr. Evans, you had mentioned a book that you thought was really important. I have another book I do my work from, which is Post-Traumatic Slave Syndrome by Dr. Joy DeGruy. And it is an amazing read to really understand how trauma is passed down through the body. And there's been research that they have done on World War II veterans, on survivors of the Holocaust, and even on laboratory mice. And they talk about how that research shows that when the body has experienced a certain trauma, how the DNA gets altered and it gets passed down to multiple generations. And so when people hear that, and I'm talking about that in spaces, I'll use an example with the mice. So what they found is that mice naturally, for their own survival, they actually come out and they run along the edges of walls to protect themselves, and they do not come out in the daylight. They come out at night. That's a protective factor. Well, what happens is once they had been traumatized, multiple generations down, they were finding out that the mice were coming out and doing things that were maladaptive to their survival. They were coming out in daylight and they were no longer running along the edges of walls. So now they're doing things that are counterproductive to their own survival. They found that in World War II veterans, there were different things that they saw in that DNA in terms of people who had experienced this trauma and came back and had children, and how there were different correlations to different vices and behaviors that were being picked up. And so how that was maladaptive to their survival. But yet and for all, we have not talked seriously about what has happened to the descendants of formerly enslaved people and the atrocities and the traumas that people have experienced and seen, and then we continue to experience at the hands of what's happening in this country. And now we're in a space where there was once upon a time where you had to witness the trauma, and it would have been a one-time occurrence, or you had to be in that space repeatedly, and time has gone on. But now we live in an age of social media where people are reliving these traumatic experiences of what's happening to the Black body over and over and over, and that gets internalized. And so we have various forms of vicarious trauma that we hold in our bodies as well, from witnessing what is playing out and it's a direct reflection. We see ourselves in some of these very people that we're witnessing and thinking that they're separate from us, but we see ourselves as a part of that, right? So there's a lot that we have to really think about in terms of what that looks like. And when we start talking about how do we build, it's difficult to build upon brokenness, right? So we have to be able to recognize what that brokenness is, and and how do we start the healing process? What do we need to do to start to close some of those gaps? And so again, when we start talking about the social determinants of health, that's extremely important. I also think that we have to look back at the family structure and unit, and we have seen it be broken down, and where society has told us that that is not something that is valuable, and it is very, very valuable, where we need to be able to really reconnect. And I always say that Black women, we've been taught in many instances that our allies are not the people who are technically supposed to be our allies, and that's Black men. Black men and Black women have to be and must be true allies with one another. And it's not about looking outside of our community. That's an extra added bonus if it happens, but that is not, this should not be the standard for what we should be doing to look at how do we address and build upon and start to heal from, so that we can build upon solid rock and foundation to address the issues that we're experiencing.
Wow, thank you, Tiffany. Calvin, I want to make sure that we bring you and your experience in. Tiffany brought up a lot of different things just now, but also bring in the family structure into the picture. But would you like to pick up on anything that Tiffany said, or offer another perspective?
May you repeat the original question just so I can make sure I'm tying it in?
I think the original question, we were talking about health disparities and social determinants of health, and how they interconnect as well. But then also, I think we transitioned on to trauma-informed care, and what the role of the generational trauma plays in our health and well-being. And we then transitioned in taking it more into like the family and what's important in terms of the family and the role that it plays in healing.
Gotcha. Understood. Yeah, I'll definitely have to add into that. As with a lot of these issues, these are things that get, again, complicated, muddy, and all connected. Because when you talk about, a lot of times when you look at all of the different factors a child may be born into, one of the greatest determining factors of their outcomes in life is not their intelligence, it's not, where they're born, it's not their race. A lot of times it's the financial capability of the family they were born into. And how well you can hold that unit together a lot of times starts with the economic stability, because when you lose that, then one parent may be working more, or one parent may be out of the home more. So then you lose that nurturing element. And again, it's a very, very slippery slope. But I think it's also important to note that sometimes these things don't always, or not all of the outcomes are in themselves negative. Within our communities, I believe our family units may look different than in some communities, or speaking specifically in the Black community, where a lot of times there may be households that may not be a traditional mother and a father, but there may be a mother and this uncle, or there may be a mentor from the neighborhood. I think we should expand how we look at family, because if we're starting from something broken, we have to get somewhere that we can heal from. And sometimes the pieces that we have, they can fit together in different ways.
Yeah, I agree. I think one of the things that I'm learning, recently is about how we frame things and the importance of language, and the way that, if you frame even a community strengths, if you're talking about it from a strength-based perspective, then you're identifying the resilience of the community, the strengths of the family. As you talked about, it doesn't have to be negative because our family structures may look different, but it is what it is. And so what are the resources and the support systems that are necessary to support, these unique family structures? One thing I'm thinking about too is just about behavioral health, and how can we ensure behavioral health and mental health and substance use disorder treatment is prioritized within this health equity work.
I think if we're truly committed to health equity, I think that behavioral health can't just be an afterthought. Mental health and substance use disorder treatment are really critical and they're not optional. If we want to achieve true well-being, particularly for the Black community, where access to resources and trust even is often low due to just criminalization of, just different substances. I think substance use and behavioral health both are like there's a lot of stigma within our community. And it makes it an under-addressed issue. But it's not because there's like a lack of need, there's systemic mistrust, and there's tons of barriers to care, whether it's cultural stigma, again, bringing back up like the historical harm that we see in present day, and then not having providers that look like us, issues with insurance coverage, which is now, in greater risk with all of the executive orders and, who's in charge of health and human services. Those are real things. And so, we have to really center behavioral health work within health equity to make sure that we're taking concrete actions to address it. And so really normalizing as a part of health in general. It shouldn't be separated. They should be integrated together. Mental health screenings when you're in a primary care setting, when you're looking at chronic disease management, and we should really frame behavioral health as essential to thriving and not just simply surviving. And definitely not something that should be siloed or is stigmatized. It must be seen as something that's just as important as your physical health and your overall well-being. I think expanding access to trusted community spaces is important. So investing in community-based and culturally grounded services is really critical. You'll find people that look like you that understand your background more, less judgment. And this could mean having therapists that are embedded in schools and churches, whether it's a barbershop, a community center, whether you get a community-based organization running your own, you want to really create a space where people feel comfortable. And then we also need to scale up those services. So whether it's like a mobile crisis unit type thing, peer support programs, used to be, we'll see what happens. I think that's something that we'll need to address, but peer support programs and funding for that. So you can be trained yourself and you're equipped to handle, crises when it's someone that or someone that's in the same area as you. And I think telehealth is also an option that we should look more into and have a system that's designed with Black users in mind that makes it more flexible and convenient for people to use. And then again, I think funding and storytelling is important. The more we talk about it, the more it's understood, the more comfortable people feel. It kind of destigmatizes mental health and it elevates lived experiences, and it kind of allows you to reclaim healing just as a collective right and not seeing it as a weakness. And then again, I think behavioral health outcomes should be actually included in equity dashboards, and it should be tied specifically to funding decisions. Again, like having it as an afterthought is very detrimental and it disrupts resource allocation. So when we're talking about behavioral health, it should be advocated for when we're thinking about Medicaid expansion or cross-sector collaboration. So like healthcare, behavioral health, housing, criminal justice, like all of those things should go together.
And you talked about, a couple of times just about where we are in the current environment and things that services that, you know, could be at risk and things that are necessary supports for the Black community. I don't know, Tiffany, if you would like to go into a little bit, but just based on your experience, based on, you know, your connections and what's happening on the ground, can you talk a little bit about what you see are some of the risks or threats to health equity and gaining health equity in Black communities?
Yes, we see it with this current administration's executive orders that are coming out. And so we, nonprofit Prince George's County, we have over 250 nonprofits that are members of our organization. And we are constantly working to monitor and to look at the EOs that are coming out at a very rapid rate. And it is very challenging to be able to process all of the pieces, because oftentimes what's happening is people have to go into litigation against to take some of these executive orders to court. And so we are finding that nonprofits, not just nonprofit organizations, but also the foundations that fund nonprofits, are in the crosshairs of being at risk. I mean, there has been clear guidance stating that the administration was going to identify organizations that had over $500 million in assets or more, and they were going to specifically target those particular entities. And those entities are the funding entities. Those are the entities that provide the resources to other CBOs throughout community that provide all of these different services that we're talking about. And so we are really going to have to start looking at how do we reframe and look in other spaces for funding, because we've been so heavily reliant upon government funding, whether it's federal and federal trickling down to state and then local. And that has been a huge area of focus for a lot of organizations that have not just provided services, but also employ people that look like the very communities that they're serving. And so I don't have a concrete answer for that. We're still trying to figure out what that looks like in terms of how do we go back to a way where we are able to self-fund or look at other ways where we're not as heavily reliant and dependent on federal government, because it's clear what the plan is. And I think we're trying to figure out a way to be responsive and not so reactive at this moment.
Do you all feel that people understand, you know, the impact of you talked about the EOs, the executive orders, and, you know, how that's going to trickle down and impact services? And if not, what needs to be done to spread and increase awareness at the community level?
Go ahead.
If I can jump in, honestly, I doubt it. And I hate to say that, but on an individual household level, I don't think, politics is very polarizing, especially right now. A lot of people are turned off to it or hyper focusing on some of the hot issues. And I think a lot of the policy decisions and how they will actually affect communities sometimes get lost in the mix. As far as for how we can clear that up, I think that takes individuals stepping up, getting educated, advocating, which is one of the core competencies of community health work, and making sure that we're spreading that awareness.
I wanted to add to what Calvin was saying. I agree with you. I don't think that that most people understand the impact of what these EOs are doing. I know that we've been waiting kind of, today we were expecting some other EOs to come out where they're possibly going to challenge the nonprofit status, like change the criteria for a person's 501c3 status, depending on who you're serving. And if you're serving a population of people that's deemed where the administration is saying that they don't want you to serve, then that could potentially put your nonprofit status at risk. Or if you're doing work, if your mission of your organization goes against the policies that the administration is stating, it would put your nonprofit at risk. And most nonprofits that are the majority that are Black-led are not organizations that you're looking at. Like in Prince George's County, for example, 75% of our nonprofits operate with a $25,000 annual operating budget or less. 75%. Now, let me also clarify, there are over 4,000 registered nonprofits in the county. That includes faith-based organizations, social and civic. It includes, but if we're looking at who's doing the key health and human service-based work, we're looking at about 600 to 700 in a community of about 1 million people. I say that to say that the majority of the nonprofits are still going to operate with less than $500,000, even those that's considered a well-funded nonprofit where they have some staff, they have space, and they're providing services. They're not necessarily equipped to deal with litigation, to go to court against an administration that says, I'm going to call out, I don't like the work that you're doing, or I don't agree with your mission. And so it creates an environment that makes it very easy. It makes the organization very vulnerable and at risk. And so some of the foundations are trying to build resiliency funds to help with getting additional legal counsel for organizations that don't traditionally have that type of legal counsel or access to that. And also looking at ramping up insurance, different forms of insurance for coverage, for liability coverage, increased liability in case your organization runs into these issues. But again, to your original question, when you're dealing with that, if these organizations go away, then we're talking about people who are providing housing support. You're talking about people who are providing food pantries that their doors are closing. You're talking about people who are providing diapers and baby support for people who are in need of it. A large portion of nonprofit organizations are providing the services that government can't and won't provide. And so if those doors close, what happens? And so a lot of people don't understand the real impact of what happens if that sector goes away and is impacted in that way.
Dr. Evans, did you have anything you wanted to add on to that?
No, I agree with what both Kelvin and Tiffany had to say. I think it's very scary because these are our safety net programs. And so if they're not there, there's nothing else. And I think the chaos that we're living in is very unfortunate. I think it's, as people, we don't understand, but I mean, even our legal teams, our Supreme Court isn't able to keep the president in check. So we really do have to be very creative and strategic about how we plan to move forward.
Let's talk a little bit about, some of those strategies. I know you just talked, Tiffany, about the resiliency funds and the funding and liability coverage that's being set aside and the planning that's being done. I think of the fact that we're in different time now, which calls for, like you just said, different strategies and being creative and innovative. Can we talk a little bit about some of those strategies for community and culturally competent organizations or culturally competent strategies? And I'm thinking also about cross-collaborative strategies working across the aisle. How do we pull our partners in at the community level to do this work? And what are some other strategies that we can talk about, knowing that we're facing some unprecedented times?
If I could speak from what I'm observing, I think there's a mutual struggle right now just because the administration has changed and policies are changing and the financial landscape is changing. And that creates a lot of uncertainty among some of the organizations that are intending to support the community. And I think that it is a pressure, but it could also be a good opportunity to put some organizations closer together and see maybe how we can, work together in more creative ways to share capacity.
Mm-hmm. I agree with Calvin. I will say that it needs to be done with trust building in mind, because what we've seen historically, I know with a lot of our organizations, is that people have a goal, there's a passion that they have to do something. But if there's been limited funding and specific historical disinvestment, then they've been operating from a place of scarcity for quite some time. So it makes it very hard to come in and trust, especially when you have larger, well-funded entities. So whether that is educational institutions, whether that's a much larger CBO that will have the resources and come in and say, well, we don't do work in XYZ community, but we know that you have the trust of XYZ community. We want to give you a couple of dollars, even though we receive the bulk of XYZ, and we're not going to be upfront with you about that. And we want you to go out and do the work that we're not going to do. And then we're going to write the beautiful reports and we're going to submit them, and then we'll get the credit for that, right? And so when you've had organizations that have experienced that time and time again, then there is oftentimes a breakdown of trust. And so it's very imperative that when you're bringing organizations to the table, to look at how to cross collaborate and looking at these opportunities that exist right now, to bring them in and be very explicit, like manage expectations on the forefront of the conversation instead of the back end. A lot of times we'll say, well, let's shake hands, and then something happens, and then people feel, disenfranchised or disrespected. And then you will find that everything that they started to build gets broken down very easily. And we have a lot of our agencies that have come to me and said, we can't do this work because once we bring in 5 organizations together, whoever the lead organization is, someone else may come back and complain about the dollars or something. We have to start having these conversations up front. We need to be realistic, manage expectations, and talk about what people's roles can and should and will have to be, and how it can grow as dollars may grow. But we typically shy away from like money conversations. And the reality is we do live in a society where people are still there. They require their check to pay their bills, to fund whatever it is that to manage life. And so I think that as we have that conversation, it is very complex, and we need to be able to be very delicate, but be very direct and manage those conversations in the beginning so that we can have stronger collaborative opportunities. And I think that this is the time to work with organizations that don't do similar work to what you do, because we're in conferences with people who do similar work. We're meeting with, those are our colleagues. Those are the people that we network with regularly. That's great. But what about, working with someone that does work so different from what you do, but together it helps to create a more holistic, response, and it could be stronger. And that's what funders are also trying to seek, like funding foundations are saying, like, we want to see some other ways that our dollars can be more impactful. And how do we get to the place where we start to, as they say, instead of giving a person a fish, teaching a person to fish, and equipping people with some of the skills and resources. So yes, we're going to provide food, but where can we also grow gardens in our community? If we grow gardens we're teaching people how to grow those gardens, then we know that at least we are equipping people with some of the skills and resources, that they're not waiting for whether the pantry is always going to be open or closed, because if funding goes away, that goes away also.
So we call sustainable solutions. Dr. Evans, did you want to chime in on that?
No, yeah, I absolutely love everything that you said. And I feel like that's something that isn't spoken about enough. I think that all money isn't good money, and everyone's intentions aren't pure. So in this time, I think it's so important to really have those upfront conversations to make sure you're aligned on goals. One of my biggest issues or the things that kind of bother me with research, for example, but this translates to other sectors, is the community-based approach. Like, it's not truly community-based. Like, it's very, I'm going to have this person sit in an advisory role, or they're just kind of there, but they're not able to make decisions that would be helpful for the community. They're just almost like a figurehead. And so I think it's, we have to be mindful of who we choose to work with us, and again have those conversations ahead of time. And then I think the point that you had brought up about working with organizations that don't do the same work, I think that's so critical in building our own sustainable infrastructure without having to rely on the government, for example. So you have a housing organization working with someone that provides healthcare, working with someone that provides diaper, you have that full infrastructure, and then we don't have to rely on external, sources. And I think that's a really critical component to be able to build up our community capacity to do those types of things.
On the policy front, I'm thinking about, Medicare, Medicaid, and all of even the supports you just talked about, all speaking to social determinants of health, right? It kind of goes back to where we started with the conversation of addressing the whole person and addressing all of those issues and challenges that a person is going to experience. In terms of advocating for policy changes, how do we do that, and what needs to be done to address some of the social determinants of health and challenges that we see today from a policy perspective?
I think storytelling goes a long way. I think the community definitely has the stories, and people have access to different people. So you can be the head of a nonprofit and you have direct access to your commissioner or your governor, those types of things. So I think that storytelling piece, and really getting to know your policymakers and just really developing a community allows you to really advocate for policy. And I think it's more important now than ever. I think broadly speaking, our elected officials have not done us justice. They have not done right by us. And so we also are in a position to be able to kind of develop and cultivate new up and coming leaders to represent and to help us advocate for policies long term. So I think that's just a very initial kind of starting point to help us begin to advocate for policy changes.
I wanted to add to that I think that policy is so critical. And when you look at a lot of our organizations that are doing, work on the ground, they oftentimes don't have someone that's dedicated and able to follow and track different bills that are being proposed and to monitor legislation. I mean, there are people that's what they do, right? That's what they do. I worked in our Maryland General Assembly for one of our legislative sessions, and it was very interesting to see who was coming up during session. They were not, although I worked for a senator's office that looked like me, the people who were coming in did not look like me. They had dedicated people to come and push agendas and information while somebody else was back doing other work. But we oftentimes don't have that same opportunity due to time constraints. I mean, you have to follow the legislation. You have to meet with your elected officials. You have to be able to have someone look at the bill and see, well, does this bill include language that is going to be equitable, right, for my community? And then you can come and make suggestions to your elected official to change that language and to make those type of edits to the bill. But you have to be able to follow and track that, and that is a job in and of itself for people. And so while I know that it is critical and it's imperative, this is where we start talking about like collaborations. How do we work with organizations that's what they do? They focus on advocacy and tracking policy, and they're bringing that policy back to say, these bills are being introduced. Are you for or against these bills? How will these bills impact your community in a positive or negative way? Or what would you like to see added to it before it gets, whether it's being introduced on the Senate side or the House side? And I think that we have to find ways to do that in a more cohesive manner, where even though if we don't do policy, we should be working with entities that do policy and will look at policy from our perspective, from the Black lens, for what we need in our communities, because it looks different depending on the community that you're talking about. You can say that we're going to do something with waterways in one part of a community, and we're like, wait a minute, that's going to create some issues for our water system. But if we're not following and monitoring it, then we get those type of negative outcomes. Whereas there are other people that are actively following the environmental footprint that different activities or different legislation can cause.
I think that's also where you partner with your local ACLU or, you know, law firms that do pro bono type work. How you had said earlier, just, you know, working with people that don't necessarily do what you do. I think we can all uplift each other. So I'm so glad that you said that.
Calvin, any policy perspectives or approaches that you would
Yeah, just thinking in
recommend?
terms of being creative about it. If we lack the capacity there, we do rely on our elected officials to a certain degree, but we can also, elect somebody within our family or our community, that okay, maybe that's the person who they go out to all the community meetings and they report back to the family, or other ways that we can also hold our elected officials accountable, because another part of not receiving the outcomes that we seek for is not having that bridge open. A lot of times, politicians, they have a certain stigma within the community. So even somebody that wants to advocate for your community sometimes has to convince you to even give them enough trust to get the insight to approach policy from a person-centered perspective.
Mhm.
Politics is tricky. Politics is very tricky. You go in with good intentions and you see people change, and it's a very tricky uh thing to navigate.
And I also want to add there's power in numbers. There's
Mhm.
absolute strength in numbers. A lot of what I learned working in this space is how many calls are you getting? How many emails are you getting? And so we cannot rely and assume that because a person looks like us or they've been elected into this role from our community, that they're naturally going to vote on legislation that is going to be beneficial, because it's really going to be contingent upon they're looking at their constituency and the calls and the emails that they're getting. And so while absolutely one person can make a difference, 100 and 200 people, strike a much, make a much louder noise.
Mm. Yeah. In terms of, priorities, and I understand every community is slightly different, right? Their own unique issues and sets of problems or challenges. But in terms of 2 to 3 priority areas to focus on collectively to build healthy and living and thriving communities, what would you all say would be about just 2 to 3 priorities that you would focus on and that we should keep kind of zoned in on?
I would put mental health at the top of that list, because everything stems from our habits and our decisions, and everything, all the stresses will come back and affect our mental. And I would probably put access to resources, access to education, health, those two.
I would I agree with Calvin in terms of mental health being at the top of that. I also would add to that physical activity. And so I state that, and I'm married to, my husband is well, he's many things, but my husband, he is a fitness trainer. And so, but he has come from one of the most challenging communities in Washington, D.C. as a fourth generation Washingtonian. And so even through those challenges, one of the things that he always, reminds me of is the importance of moving my body to counter some of the other effects of some of the other social determinants that we are exposed to. So whether it's poor food, and again, I'm not saying that negates all of those things, but those are I've heard him say that, but I've also witnessed him live it, and it shows up very different for him than it does for me, because I'm nowhere near as physically active as he is. But I think that that's something that he has always been, and I've seen that reflected in the difference in him and other people in his community that he grew up in, because he's very consistent and committed to that. So I think that that's something we have to figure out, how to lead less sedentary lifestyles. And it's difficult when we're on Zoom sometimes for many, many hours, or we have 2 jobs or sometimes 3 jobs. It's doing homework with children or being a caretaker to, someone else in our family. I mean, there's so many different variables. So I'm not negating any of that, but I do think that finding a way to counter some of the challenges through through physical activity.
Yeah, I would say the same, and like bolstering our public health kind of knowledge, just like broadly speaking. So increasing our knowledge about what keeps us healthy overall. And I think also a part of that is a priority should be economic stability. Housing is not affordable, food is not affordable. Just it's there are tons of barriers, and so people can't even, pay their rent or, buy groceries for their kids. I mean, you're kind of stuck at zero.
Mm-hmm. Mm-hmm.
Can I Oh,
No,
I'm
go
sorry.
ahead.
Like, can I also add one more thing? I know I've seen a lot of our programs focus on youth and other populations, but I also don't want to miss our senior population.
Mm.
That's a population that I have seen in many regards has been overlooked in our community. Um, and I want us to be able to really help advocate for our senior population as well. And so, when Dr. Evans was talking about what's affordable and not affordable, I can tell you we hired a woman, she's 82 years old, in our office because she had been retired for 8 years and was in danger of losing everything because her retirement did not go very far and she lived alone. And so we advocated to our elected officials with no type of response. And so at this particular point, it was like, send you to a job program. No, we have to create an opportunity for you. And so she talks about it all the time, but she is also a rarity. Most people are not necessarily hiring 82-year-old women into the workplace at this moment. Some people may not be mobile. Some people may not have
Mhm.
access. Some people may not have the transportation, or they may not have the skill set to be able to offer whatever is needed. But and she always talks about there are people that are stuck at home that they just cannot get out, and they're being overlooked. So I just wanted to also mention our seniors that I feel like we could do a much better job with supporting.
And they come with so much wisdom as well, so much wisdom that they can pour back into us. And I think that that's also a key thing to remember as well.
One thing I think about, even innovation and technology, sometimes it can, be used to divide us, right? A way that, can divide communities, but it also can bring communities together and give you greater access. I think of telehealth, for example, telemedicine. But I'm just wondering your perspectives on, different innovations that we're seeing now emerging, obviously artificial intelligence. How do you see those tools or systems, playing, and what role do you see them playing within, health equity? How do we maximize those opportunities so that we can achieve health equity? What do you see as some of the risks? Just would love to hear you all talk a little bit about that.
Mayor,
Please, Calvin.
in terms of health equity, I think we need to take that into heavier consideration with how we access our healthcare today. Because if you don't have a phone nowadays, it is
Mm.
very difficult to get through life. Sometimes you can't even do something as simple as go to the gym if you don't have a phone. And if somebody is in an environment where they have less access, that can be particularly greater problem. Imagine if someone's homeless, for example, and they
Mhm.
have a phone, but they can't charge it to get the access that they need. Things that are very easy to overlook, but when we take them into consideration, maybe things that we can address. But I also think in terms of creating opportunities for people to come together and caring for our seniors, because that's another segment that's largely left out. You have a large senior group who they may need assistance and they may even qualify for programs, but they may have difficulty navigating the website or the portal or getting through the application process to even get the support that they need. But that could be an opportunity to bring generations together because we have generations like my generation that was born into the internet, or even as I look at those coming up younger than myself, in the AI generation, they engage with technology in a slightly different way than I do, and same way as mine is slightly different from my parents who had certain technology that I didn't. I think we have to be mindful of that ahead of time because technology, by the time, we're seniors, may not look like what we're dealing with today. And we
Yeah.
have to make sure that we don't get lost in that transition as well.
Very good.
I also wanted to add to that, when you were talking, Calvin, about the different generations. Again, I was thinking about the person in my office and how she started with not being able to send emails and attachments. And then, there's someone that's 22 that's in the office that's spending time with her, teaching, and they're going through this process. But I will say that while technology is here and we know it's not going anywhere, I know that we are extreme users of technology. We're not necessarily the creators of a lot of the applications and the platforms that we utilize so much. And it's interesting because I'll be deliberate and intentional sometimes. Like I came off of social media for 3 years. And people could not understand. My family was like, you did what? But it reduced anxiety in my body. It reduced significant anxiety. And so there's some days that I go to the grocery store and I will leave my phone at home and I will just go to the grocery store and they act like the world is going to fall apart. And for me, it's not. If there's an emergency, then I'll ask somebody else to use their phone. But it has reduced a level of anxiety. And I understand that I may be in the minority with that, but I also think that we have to understand that while we use technology, technology uses us. Technology gathers data on everything that we do. And this algorithm goes back to tell a story. It tells a story about us. And that story is then utilized by different corporations and different entities to market or to determine like where are we going to put dialysis centers or where are we going to put, we need to put some more. So if the dialysis center is there, then they still need to have people coming to the dialysis center. So are you going to put a healthy grocery store with whole, vegetables and fruits that are readily accessible? Or are you going to have a fast food place or the carry out that is right next door to said facility? And so I just say that because oftentimes if we look at our phones, we will see that a conversation that we just had, all of a sudden we're targeted in terms of the marketing and the ads that pop up. And I know a lot of times we look at it and we dismiss it, but I think that we need to move it more to the forefront of our minds and understand that what we think is recreational, what we think is private, it's not private. Once we turn our phones on and once we log onto our computers, there is data that is being collected about everything that we say and that we do when we think and we feel. And so it's not, I'm not saying it to be alarming. I'm saying it in an effort to educate and make us more aware of because once we understand that, then we can be empowered on how we will utilize and what we will share and what we will not share in these platforms.
I agree with that. And to touch on the AI piece, I know that they are currently using that to like screen for health insurance claims. They're using it as a substitute for people working at Social Security and those types of things. I think technology is a very beautiful thing. There are amazing things that can come of it, but I also, in the same breath, will say that it is moving very quickly. And we are not keeping up with regulations to make sure that it's safe. And so I think that is a major concern. I think that's something that we should all be leery of. Yeah.
At this time, Amal, I don't know, would you like to open it up for questions from participants?
Absolutely. So if anyone has any questions, they can raise their hand. I can unmute them, and we also have the chat and the Q&A function as well. So if anyone has any questions, feel free to raise your hand. Now would be the time.
Well, while we're waiting for questions, I just wanted to say I appreciate having this conversation, and I'm hoping that we can continue, to build in some sort of way, regardless of where we are physically located. I just think that it would be very important and it would just be helpful to our communities to be able to stay engaged and connected.
Absolutely. I think it would be a great idea. So if anyone wants to connect with any of the speakers or panelists, I also think it would be opportunity right now through speaking to them as well. And then, yeah, if there's any questions, if not, then we can go ahead and start wrapping up the conversation if anyone has any questions.
Would it be okay if I ask a question?
Yeah, absolutely.
Earlier we talked about the our two, I guess, most important social factors. Uh, are there any that you think that we may not focus on but are like the most overlooked or often overlooked?
And let's pose that to your colleagues your panelists, Tiffany and Dr. Evans. I'd like to hear if you think there are some that are overlooked, as Calvin is pointing out.
I'm sorry, did you say, are there specific social determinants of health that are overlooked that you think we overlook? Was that your question?
Yes. Not
Um,
necessarily the most, important, but ones that fall through the cracks.
mm, I think the biggest one, the one that I think is the most important, they're all equally important, but the one that I see, um, that could be addressed more as the economic stability piece. I think there's tons of focus broadly on health, like broadly on education, but once you're a grown adult, nobody cares. And so there's not tons of like workforce development type programs. There's not tons of funding into like GED programs to ensure that everybody's provided economic stability. And so while they're all important, I think that is the piece that's probably the most overlooked. And the older you get, the more complicated it is, right? Like now you have kids, like now you have like you can't just miss work. Maybe you're working like an hourly job. You can't just not go and go 5 hours of training. That'll take maybe 10 weeks or more, just depending on what the training is. So it gets very complicated, and I think we could invest more in that particular sector, especially with our current political climate and what's going on.
I agree with Dr. Evans. I think that it's going to be economics. That's something that no matter what else we talk about, if you are not economically secure, then we can talk about housing all day, but then your housing is contingent upon somebody else's benevolence, or as opposed to can you afford to pay to live where you want to live? Can you afford to pay for the food that you would like to be able to eat? Can you afford to pay? So, I mean, all of that ties in. And then what you do with those resources. I mean, we have been in spaces where we've heard about people investing in cryptocurrency and investing in the stock market, and basically becoming wealthy in a very short period of time and retiring early. And so there's a financial literacy component to that as well, in terms of how you're introduced to money, and how what economic security looks like for you and your relationship to money and your economic dynamic. So
Mhm. Great question. Are there other questions that even the panelists may have, even of the participants or each other?
I don't have a question. I will, I just go back to saying we are in a time that collaboration is critical. It's not something that we should do. It's something that we have to do. And
Mhm.
as we spoke a little earlier, and we talked about whether people realize what's going on, I think that it's important to have conversations with the people in our families that don't do the work that we do, right? Because everyone's not exposed to these type of conversations, or they hear them and they're like, oh, you're just kind of talking that way. But whether you have been impacted today or not, like we know in our communities, the impact will come. And
Mhm.
so some people, I know we've talked about federal government positions, and I know here in our county in particular, we had 70,000 federal workers, over 40,000 lost their jobs, right? In this county alone. But that's before we get to federal contractors, it's before we get to private sector. And so some people have been breathing a sigh of relief. They're like, ooh, that's the federal workforce. No, there will be impacts, right? There are impacts that are happening. And so sometimes we wait for it to come directly in front of us instead of really understanding and preparing for what that looks like. I've heard people talk about the tariffs, and people said, well, they don't think that that's going to impact them. Like, there's certain things that I'm like, I'm gonna stock up on before, we get to this place where we see, like, many of us have not lived through a true Great Depression. And we don't know what that looks like. We may have read about it in books or seen, clips on television, but we've never seen what it's like to, as where a large swath of our community did not have access. And I think that we have to really prepare and prepare people in our immediate circles to understand the potential of what can come. And even if it does not, at least prepare. It's better. My father used to always say it's better to know me and not need me than to need me and not know me. And so I think it's better for us to be prepared and not need that preparation than to be unprepared for something to come, and then the pain points are exponentially higher. And we know that that happens in our community, overall.
I 100% agree with that. And like in relation to health and the tariffs, like it may be nearly impossible to get medication, like necessary needed medication based on the taxes and the tariffs that it'll take to bring, drugs in and out of the country. And so the way we market and describe things, I think it should be really, really simple. I think when you're watching the news or whatever, you're talking to people that have the same education level or understanding as you. And so the message and like what's really going on can get missed.
Mhm, mhm. And I want to bring in a question from the chat. Carla asked, is there one thing that underpins economic security? And I don't know if she's able to come off of mute and ask or chime in as well, but that's her question from the chat. Anybody like to take that on?
I'll take a stab at it. I think one of the biggest things that underpins education is yeah, that underpins our economy is how people make their money. And I say how because a lot of times that determines first off, money determines most of our decisions. Even when it comes to knowing the right thing to do, you can know the right thing to do and not be empowered to take that action because of your financial circumstances. And then that creates another situation where you have to actively process choosing, which suboptimal decision you will make, knowing you can't make the best one. And how we get money plays into a lot of that. We may, in certain communities, rely heavily on government assistance, but that creates natural issues where there's that gap space between, okay, I may want to earn an income, but if I earn this much money, I get kicked off of that support. But it's not enough money for me to fully sustain myself. So then it's like, well, how do I cross that gap region? And that's where a lot of people unfortunately have to turn to other ways of making money that may not be fully legal, that may expose them to greater risks, but your economic stability does affect a lot of your decisions. So at the end of the day, it has to play a role. And I don't think, that should be limited just to education factors, because if we already know within certain communities that is one of our barriers, then we have to create ways, especially with IT, rising, I'm sorry, artificial intelligence becoming more powerful. We have to create ways that people across the entire spectrum still have ways to sustain their lifestyle in a healthy way.
I would also like to even reframe the thought of education. I do think it's the most important. And I think education isn't just like academic. I was in a call earlier this week, and a really brilliant lady had said her ancestors or people of the past could like build houses. And today, we just sit at our computer. And so I think it's important to like understand that your knowledge doesn't necessarily have to be book smarts, but it's just like your knowledge to be able to do anything. Like tons of people can cook, tons of people can grow, people know how to build things. And so really tapping into our skills, like we were given skills for a reason. And so I think really understanding what your own capabilities are and then lending it to your community to then build an infrastructure is something that can help bolster economic security for you as an individual, but then also for your community.
I wanted to add to that. There's so many people that research. Like we are researched people. People research everything about us. And so even the things that we're talking about, there is research for all of this, right? So even when Calvin was talking about um uh how people get to this place where they earn too much. So the United Way calls them ALICE. And ALICE stands for Asset Limited Income Constrained Employed. That's what the acronym stands for. There's a whole term for people who are asset limited, income constrained, and employed. And they say what happens is they fall off the benefits cliff. They make just enough that then they lose all of their benefits. And so they talk about the ALICE person and how Alice people, you know, how they are at a deficit. If they may go into a job and they're doing really well in this job, and then all of a sudden they get a 50-cent increase in their pay, and all of a sudden you don't longer qualify for what housing voucher or a different levels of support. And so we are so researched that people can tell us about these things, and we know that it exists, and there is still not the proper ins like insulation to protect us. And so this is where we have to go back and say, okay, so you've done this research. And I've always said to people, you know, in the work that I've done, they always talk about, you know, what's evidence-based. I'm like, well, who's determining what's evidence-based in our community? Because we have people that look like us that are absolutely brilliant, that have done the research and that can tell you what's working and what doesn't work. But then oftentimes they're looking for other folks to come in and they're using their research and their data to say, well, this program needs to be implemented in your community because so-and-so said that it's evidence-based. And I'm like, what does so-and-so look like? Like, where is so-and-so from? What do they know about my community? What do they know about my people? And so those are some very real questions that I think that we have to have, because people who are we're looking to as the experts are not the experts in me, right? And I will share I'll share a personal story. I had my son is 6. I had my son at 40. And so as an older mom, I remember going in and I'm also a survivor of sexual assault. And so I went in to talk about when they were getting ready to do the examination to tell me like how far along I was, and I was deathly afraid. I did not want to have children. And so I went in and I talked to the doctor and I explained my situation. I explained that I was a survivor and I asked for a different type of test if that could be done. And I remember the doctor said to me, well, I don't even know how you even got pregnant. How did you even get pregnant? Because I was, you know, teary-eyed. I was very upset. And so I called my husband. I said, I can't go through with this. I can't go through with this. I'm not doing this. Oh my goodness, this child that I have is the most amazing gift. But it was because of the doctor that he told me to calm down and for me to get myself together in the parking lot, for me to call back to the insurance company. So I'm an advocate. I do this in my day-to-day work. So I was able to call and say, I need another doctor. I need another doctor right now. This is my experience. Through my tears, through my pain, I could say what I was and was not willing to accept. And they gave me another doctor, and I went and I met with this doctor, and she made all of the difference in the rest of my experience in my pregnancy. If I had had a girl, I would have named my baby after my obstetrician. This Black woman was amazing. I mean, to the point where down to getting ready to have an epidural, my husband couldn't come in the room, and she saw that my heart rate was going up, and she made the executive decision to allow him to come in the room and to hold my hand so that my heart rate would go down while I can look in his eyes while they gave me this epidural because I was so shaky. that made the difference in my, and so I know we're not talking about maternal health. I'm just saying overall, like when you're talking about these cultural competent or culturally responsive, I don't even want to say competent, cultural responsive approaches and experiences that, that we have got to get to a place where we're having people who are from our community, that know our community, are able to use their intellect and their brilliance, and then we push back to say, no, we want their evidence-based approach, not someone else that does not know who I am, who cannot speak to me. And so I was just thinking about that with with Alice, and that whole entire, it's a whole report. It's multiple reports that are done specifically on this, and yet we have not found a way to prevent people from falling off what they say the benefits cliffs. And we know that that proves to be detrimental to families when that happens. I know I went around Robin Hood's barn with that story.
No, well, this is all, I'm sorry. Go ahead.
No, I was just gonna say thank you so much for sharing that. That was really nice. And then sorry, Natalie, what were you saying?
No, Amala, yeah, this is all health equity. You know, from the economic piece to, you know, physician's bedside manner that makes all the difference in the world in your care and their approach to your care. This is all of what it means under the umbrella of equity, health equity, and striving for a just and fair opportunity, right, to have health care and have access to it. I don't know if there are any other questions from the participants. I don't see anything in the chat. And Amal, did you have any other questions for the panelists?
No, I don't see any in the chat. And then also from my side, I think the discussion prompts we came up with, it was really nice to see everyone's responses to those, because I feel like those were questions that I also had when I was coming up with them. And Natalie, you when we were working on them. So it was so nice to see everyone and everyone's different perspectives. And since I don't see any questions, I think I just want to go ahead and thank all the panelists today. Natalie, you did such a wonderful job moderating this conversation, and it was so nice to hear your perspectives as well. And Calvin, Dr. Evans, Tiffany, thank you so much for taking your time out. I know you mentioned that, you know, obviously there's all this stuff going on in everyone's lives, but it's so nice when we all come together and have these really important conversations in today's political climate, you know, where everything's so bleak and I mean, you turn on the news and there's really one thing after the other. So having these conversations for me at least gives me a lot of hope to see everyone working in their communities and trying to make a change. So thank you so much for everyone for the work that you guys do.
You're more than welcome.
Thank you. It's an honor being able to be on a panel with you all.
Same here. Can I say one thing about health equity, Natalie? After I had my son, I would go to see my obstetrician. I knew her birthday. I always was going to give her, you know, gifts for her birthday because she was that. I just thought that, you know, we had this amazing connection. And I remember going to visit one day or going to one of my appointments, and somebody else was there looking, you know, they were talking about my doctor. And I talked to the nurse and I said, I'm the only person that has a relationship with her like that. She's like, no, she's like that with all her patients. And I'm like, oh, I thought that I was the special one. And I was like, she's the special one. And so it's just acknowledging those special people. And for me, she is just a gem. And my goal is to be a special person to someone because it made all the difference. And so hopefully we can find those special people in our community and we can highlight them, whether we celebrate them, you know, in big ways or small ways. Dr. Deborah Ann Coe, she's so special. And she made such a difference when I found out that it wasn't me, it was who she was.
That is special. And, you know, that brings me, and I know I don't want us to carry on too long, but I just read an article, it was the physician in Baltimore. And his community they love this man. They love him because he, you know, doesn't necessarily care about copays. If you're sick, he's going to see you. He's going to see you no matter what day of the year it is, no matter if it's a holiday. And do you know that he needed some, you know, a surgery or some service that he needed? He was in, you know, he had some health troubles himself. The community came together, and for whatever reason, he couldn't afford it. He didn't have access to it. and they came together and collected the funds that he needed to make sure that he got the service and the surgery that he needed to get done. And so that reminded me of that, but it's the community that we're creating, and you just don't know. It's the ripple effect, just like we talked about the ripple effect and the negative or not so great, reactions. There's also the great reactions too, and the positive. And yes, we're seeing some challenging and extraordinary times, but it's also going to bring about some extraordinary solutions. And I'm excited to see what we're going to do with this and what's going to come out of this for everybody. It's not just, for one group of people to benefit, but it is going to benefit everyone as a whole. So I am excited about what the community comes together and builds from this. So thank you all very much. I really enjoyed the conversation. I've enjoyed the opportunity. Thank you, Amal. Thank you, Dr. Evans and Tiffany and Calvin. And thank you to the organization. Really appreciate your time.
Thank you so much, everyone. Bye-bye. Have a good night.